Welcome to this PowerPoint presentation on bariatric surgeries done through the Saskatchewan Bariatric Surgical Program. In this presentation, you will learn about what bariatric surgery is, the two types of surgeries offered through the program, risks and potential complications, and myths about weight loss surgery. What is bariatric surgery? It is a surgical procedure that results in weight loss by reducing the size of the stomach, changing the way the body absorbs food, or it may be a combination of both. There are two types of surgery offered through this program. The first surgery we will discuss is called the sleeve gastrectomy. With this surgery, approximately 80% of the stomach is removed. This limits the amount of food the stomach can hold, therefore making this a restrictive procedure. Expect to lose 15 to 25% of what your weight is at the time of surgery. This surgery is not reversible. This video shows how the sleeve gastrectomy is performed.
To access the abdominal cavity, small incisions are created. Trocars are placed to serve as passageways for surgical instruments. The surgeon examines the abdomen using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes. These help break the food down into a simpler form so that it can be digested more easily and absorbed in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 and 150 milliliters and is about the size of a banana. The resected portion of the stomach is removed. By altering the anatomy of the gastrointestinal tract, sleeve gastrectomy changes signals in the body, resulting in decreased hunger and increased feelings of fullness after meals. Bile and pancreatic fluid from the liver and pancreas mix with food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or postoperative adjustments needed for the sleeve gastrectomy. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure. All surgery presents risks. Weight, age, and medical history determine your specific risks. Ask your doctor if bariatric surgery is right for you.
The next surgery we will talk about is called the Roux-en-Y gastric bypass. This is where they cut the stomach and attach it further down the small intestine. A small pouch about the size of a golf ball is then created. This limits the amount of food the new stomach can hold, making this a restrictive procedure similar to the sleeve. The difference with the Roux-en-Y is that this procedure actually bypasses part of the intestines. Because of this, some nutrients do not get absorbed by the body, making this malabsorptive as well as restrictive. Expect to lose 20 to 35% of what your weight is at the time of surgery. Again, this surgery is not reversible. This video shows how the Roux-en-Y gastric bypass is performed.
To access the abdominal cavity, small incisions are created. Trocars are placed to serve as passageways for surgical instruments. The surgeon examines the abdomen using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes. These help break the food down into a simpler form so that it can be digested more easily and absorbed in the small bowel. During a gastric bypass, a small pouch is created in the stomach using a stapling device. The small stomach pouch, about the size of an egg, limits the amount of food you can eat before feeling full. The small bowel is separated into two sections. The lower portion of the small bowel is attached to the newly created stomach pouch. This allows food to pass directly into the second portion of small bowel, where digestion continues. The upper portion of the small bowel is reconnected to the lower. Bile and pancreatic fluids from the liver and pancreas allow food to be digested completely. By altering the anatomy of the gastrointestinal tract, gastric bypass changes signals in the body, resulting in decreased hunger and increased feelings of fullness after meals. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure. All surgery presents risks. Weight, age, and medical history determine your specific risks. Ask your doctor if bariatric surgery is right for you.
Which surgery is best for me? Each surgery has specific benefits, and it's not easy deciding which one is best for you. It can depend on a person's medical conditions, medications, and overall health. Once in the program, the bariatric team will provide education about the surgeries that will help guide you in your decision making. But the final decision will be a discussion between you and your surgeon. As with any surgeries, there are always potential complications. This list includes some you will face right after surgery. When you enter the program, all complications will be reviewed in greater detail. As you go through the program, we will talk in more detail about some of the long-term complications that you see on the screen. We listed some of the common ones. It is important to realize that you may or may not experience some of these. With a smaller stomach, it is often difficult to get all your nutrients from food alone. It can also be difficult to get enough fluids. Hair loss is often associated with a drastic reduction in nutrition. Ulcers can happen because of the surgeries themselves, or can be related to smoking, drinking alcohol, or specific medications. Dumping syndrome is caused by eating foods high in sugar. And it is not uncommon to regain some weight after surgery. Adjusting to your new you can be difficult, and people may exchange one compulsive behavior for another. Certain medications such as ibuprofen, Advil, naproxen, Motrin can cause ulcers after bariatric surgery, especially with the Roux-en-Y gastric bypass. All your medications will be reviewed when you are seen in the clinic. After surgery, the team will support you through any complications that you may face. Having excess skin after weight loss surgery is normal and expected. Skin has very little, if any, elasticity. Once stretched, it does not go back to its original state. Skin removal is an option after surgery, but it may be a financial cost to you. The Ministry of Health has strict approval guidelines and only covers skin removal from the stomach if you meet certain criteria. After surgery, you can discuss options with your family doctor or see a plastic surgeon for a private consultation. Weight loss surgery is not cosmetic. It is to help people manage their health more effectively and improve quality of life. Surgery is definitely not the easy way out. It is a lot of hard work and requires lifelong commitment and lifestyle changes for long-term success. Surgery is not reversible. This is why you need to ensure this is the right choice for you. The surgery itself will not make you lose weight. It is just a tool on your weight loss journey. Weight can definitely be regained if you return to the same eating and lifestyle behaviors as before surgery. Weight loss can help improve quality of life. You may find yourself becoming more physically active and doing things you never thought you could do. You may also find yourself just overall feeling better. We so often hear in the clinic, "I just feel good." Weight loss is individual and does not define the success of surgery. The ultimate goals are the health and lifestyle benefits you gain from the surgery. Surgery can be a great tool in the journey toward weight loss. It requires lifelong changes in nutrition and physical activity to maintain a healthy lifestyle. Not all patients are candidates for surgery. Having bariatric surgery is a significant decision and requires a commitment to lifelong changes. And it is all about thinking well, eating well, and living well.